Okay. Hi, I'm Rachel McAdams and I'm from NHS Health Scotland, one of the national public health boards in Scotland, soon to be Public Health Scotland at the end of next year. And I sit in the evaluation team in Health Scotland, and we have a real focus not just on support and evaluation of health improvement, public health interventions and policies, but also in supporting an outcomes-focused planning approach to the design and delivery of policy and interventions. And so I wanted to start really by reflecting again, and I think this has been a theme that's come through all the presentations today really, is that we really need to start by having a clear understanding of the problem. So why is it that currently 1 in 3 children in Scotland, or 1 in 4 children in Scotland are living in poverty, and why is that figure set to increase by 2021? And helpfully the Scottish Government have summarised what our current understanding is of the key drivers of child poverty in Scotland. And this is great in terms of really directing focus across all areas of the system on the 3 overarching drivers, and really then unpicking what the key elements are underpinning those drivers. But I think what this nice succinct summary driver diagram fails to capture, and what many people in this room will understand, and it's been clear throughout today, is that it's a bit more complicated than this. So the drivers themselves are influenced by many factors that span not just at a local, national, UK and global level, but also they play out differently across different sectors. So we've talked a bit today about the role of the public sector and private businesses as employers, and so thinking about employment, the decisions and policies of the third sector, the public sector and the private sector influence these drivers differently. The behaviours and policies of businesses, locally, nationally and internationally, will also influence these drivers differently. Secondly, there's a lot of interaction between these drivers that this diagram maybe doesn't fully capture, in that policy decisions made in Scotland at a national level obviously have an influence on decisions taken locally. Decisions taken by Westminster government will have an influence on decisions taken by Scotland and vice versa, without even thinking about kind of the global economic context, I guess, and the interplay between these, some of which are intended and predicted and some of which are completely unintended, and maybe us who work then at a local or national level are having to mitigate some of these unintended consequences of policy decisions. And finally, the third element of complexity I think we need to acknowledge is that the experience of these drivers will vary geographically across Scotland, and they will also vary dependent on the population group that you want to focus on at a community level. And so I wanted to really just start by, again, acknowledging that, not to make you feel fearful or overwhelmed or, as others describe, the sense of paralysis of, this is too much for us to try and have an impact on. But because I think, as John Dickey pointed out this morning, is that child poverty has not always been as bad as it is now, and therefore there are actions that can be taken that will shift the trajectory that we're on at the minute. But also because we need to acknowledge that child poverty is not a simple problem. Simple problems have simple solutions. I had a headache today, I took some paracetamol, I'm feeling better. But child poverty is not a simple problem. And if we fail to treat it as anything other than what it is, a complex, wicked problem, then we'll fail to really address and change the trajectory of child poverty in Scotland. And again, there is a growing body of literature on complex or wicked problems. Some of you who maybe are managing roles in the public sector have probably gone on a training course on how to tackle wicked problems. So this is familiar to you, but I just wanted to reflect on it again. So collaboration is going to be central to any approach, both nationally and locally, and working across both wheels of the bike of government. I really like that analogy this morning. There has to be, as I've said, a shared understanding of the complexity of the problem, and that should be informed by both local needs and the evidence base. And through that understanding of the problem, you also begin to understand that everyone has a part to play in both creating this system that we're currently experiencing, that is both creating and perpetuating child poverty, and therefore everyone has a role to play in shifting that system so it becomes more about preventing and undoing child poverty in Scotland. It's also important to have a really a firm shared set of outcomes, and they should be developed collaboratively. Thankfully we have that in the Child Poverty Act and the Every Child Every Chance strategy, but it will be important to replicate that locally. In terms of action, it's going to require many actions across many partners at all levels of the system, all aligned to the same outcomes. And this should be based on both local needs and the emerging evidence base on what works. It's also going to require sustained commitment to change locally and nationally across all partners. And finally, I'm an evaluation team, so of course I'm going to say this, but we're going to need to invest in monitoring and measuring progress, generating learning, and being adaptive and changing on the basis of the learning that's being generated. So I think understanding and reflecting on the complexity really maps this difficult terrain. And I think that outcomes-focused planning approaches potentially help to navigate that terrain by providing a kind of a compass or a roadmap, whatever analogy you want to use. And so some of the benefits of outcomes-focused planning, it's a collaborative approach, or at least it should be. It supports the development of better programs by testing the logic of programs. So you're really forced to demonstrate if and how your actions align to outcomes. And that it really should be embedded on the evidence base as well. It helps to identify gaps, and it also identifies things to improve and, importantly, things to stop. And I think sometimes in the public sector, that's the most difficult thing for us to do. It also provides a framework for monitoring and measuring impact. So hopefully most of you will be familiar with the recent tool that we've developed and published earlier last week. And what's included in this, and I would maybe caveat this with, is this is our first version, and if this proves useful, we are really keen to work with you guys in this room to develop it further. So all comments welcome at this stage, I would say. So what's within the tool then, there's some practical guidance on actually facilitating outcomes planning locally. It includes sample outcomes chains that we've worked up that try to illustrate the links between the short-term outcomes that we think local partners can actually influence and how they will contribute over time to the national aspirations of the targets of reducing child poverty, and also in time then reducing the social attainment and health inequalities associated with poverty in Scotland. And it also pulls together what you're probably also familiar with, the examples of possible local actions that local planners might be able to take. So this is really difficult to read, don't worry, but there's an overarching outcomes framework, and I can provide this in other formats as well, because I think in the published version it's maybe not actually, these are supposed to be working tools, so you need to be able to adapt them to your local needs. So if anyone's interested in using this and wants it in an Excel workbook or something, please let me know, and then you can delete and amend as needed locally. So this is the right-hand side of the outcomes plan. And we have here the three main drivers that we're all working towards, and this just demonstrates how they will contribute to reducing child poverty and then the poverty-related inequalities amongst children we've focused on here. And then the different elements on the left-hand side are really trying to pull out what we felt were some of the short-term outcomes that were within the direct influence of local partnerships. So this is the cost of living, and that's things like influence of the cost of utilities, participation in education, housing costs. And these are some of the short-term outcomes for maximising income from employment. So focusing on things like transport, childcare, the economic development aspects. And then finally, income from social security and benefits, focusing in on those elements of the benefit system that local partners help to administer, but it can also, obviously, through things like income maximisation services, can support uptake of. So within the tool itself, I've suggested 4 activities that you might want to think about taking your partners through locally. And these are, firstly, understanding local needs. Secondly, mapping and reviewing your existing activities, identifying gaps in future activities, and then finally assessing the impact of your activities. And I'm just going to briefly run through some of the things you might want to consider when you're undertaking these activities, but obviously there's a bit more detail in the tool itself. So first of all, understanding local needs. Now, my two colleagues are going to expand on this a bit more, but I just wanted to say that from a public health perspective, a needs assessment should assess the level of need for public services, identify the gap between need and supply, describe the pattern of supply and the effectiveness of current services. And for child poverty, we should be giving particular consideration to the 6 priority groups that are outlined in the national strategy. So low parents, families with children under 1, mothers aged 25 and under, families where a member of the household is disabled, ethnic minority families, and families with 3 or more children. So the second activity focuses on mapping and reviewing existing activities. So as we've already heard throughout today, there's been a long-standing commitment in terms of tackling poverty and child poverty in a lot of local areas. There's a lot of existing work that is excellent and should be continuing. And this is an opportunity to try and pull that together, but also to be a bit critical of some of that work that we've always been doing. So some of the questions, once you've actually mapped current activities, you might want to think about is, do they actually reflect your local needs that you've identified in Activity 1? Are activities reaching those who need them most? Do activities contribute to the outcomes that you're actually trying to influence? And are your answers based on assumptions or in evidence? And that's probably the key. And I know, having worked at a local health board level in service delivery, that a lot of sometimes we don't pause enough and really challenge and identify assumptions that we make about how well our services are being delivered. So the third activity focuses on identifying gaps and future activities. And through this, really, it's about trying to marry up what you've identified through your local needs assessment with the outcomes planning framework that we've developed, and trying to understand what are the outcomes that you're not influenced just now. Are they outcomes that are important for your local population? And also not just to think about where there are obvious gaps, but actually what are the outcomes that you can maybe put more effort against and try and influence more. And there are a number of resources that I've identified here that begin to pull out some examples of what others in Scotland are doing to contribute to some of those outcomes. So there's the synthesis of some of the evidence at the back of the guidance document the Scottish Government produced. We've produced a sample of case studies on current local practice in Scotland, and that's going to develop over time into directory of good practice, and I think Spirey are going to take more of a lead on. There's also the What Works Scotland paper that you're all familiar with, and over time we're hoping that the K-Hub is going to become a bit of a central directory for some of this work as well. And finally then, how do we assess the impact of activities? And what I wanted to, I'm not going to give any worked examples of what a good monitoring evaluation programme looks like, but I guess I wanted to use this bit of the talk to really try and allay some fears and try and be a bit more practical about supporting you to think about what meaningful outcomes look like. And so I've put up here on the slide is a very basic outcomes chain. And you'll see it captures both what you do in terms of your activities and the reach or the intended reach of those activities. And that falls into the sphere of things that you can really have a lot of control over. So that's the services you deliver and how you deliver them. And then it links that to what you want to achieve. So that's your short, intermediate and longer term outcomes. But realistically, it's the short term outcomes that you have most direct influence over. And they will vary depending on what service or intervention we're talking about. And really, I would recommend that is the key focus of any activity you undertake to measure the impact of your local child poverty action reports. Because when you move into intermediate and longer term outcomes, you have less and less direct influence over those. And actually, as we've already reflected, the complexity of the context in which we're working within, all those other external factors around welfare reform, Brexit, whatever that means for us next year, are also having a lot of influence on those longer term outcomes. And so to make monitoring and evaluation meaningful and useful, try and focus on your short-term outcomes, but also focus on kind of more process indicators around what's being delivered and to whom. So really focusing on these two boxes here. So that's not just about counting how many interactions, it's about really interrogating who are your services reaching. Are they the priority groups that have been identified? And that through those two, you should be getting a bit of a sense of, are we having the impact we want? And also identifying areas for improvement in terms of delivery. So, as I said, there'll be a need to assess the combined impact of all of the actions within your local child poverty action reports, and to assess the contribution of individual actions within the plan on key outcomes. So it's going to be a mixture of probably programme indicators, but also probably more in-depth evaluation of particular interventions as you see fit locally. Obviously, this all has to be, you could quite quickly generate an industry of evaluating and monitoring, and that's not what I'm advocating for. You guys will know what you want from a monitoring evaluation. And so I think that's, in the guidance, I kind of unpick this a bit more. In terms of, from an evaluation perspective, we say always start not with what data is available, but start with what you want to know. So try and frame some local questions that you think will be useful, not for reporting to government, but useful for the ongoing development and improvement of your local child poverty action reports over time. And then look at existing evidence and intelligence, both qualitative and quantitative. So we're not just looking for national statistics. There'll be a lot of information that's routinely already collected through your welfare advice services, through schools, through housing, that might help answer some of those questions. But don't stop there. Also go, what do we not know? What do we not collect any information on just yet? And think about how you're going to plug those gaps. So very much be led by what you want to know first, not what's available. And so I wanted to finish by really, so we talked about, and many of you'll know, we spent a couple of months, both Health Scotland and Hannah and the Improvement Service, identifying and trying to have like an hour-long conversation with local leads in both the NHS and local authorities. And we've been reflecting on what you've told us, both in terms of where you're at just now, but also what you might need over the next 12 months to help you develop local child poverty action reports for 2019, but then ongoing support as well. And these are just some of the actions that I wanted to pull out, and I'd be really keen at the end to get a sense of it. Does this seem like this will be useful, as well as feedback on what we've done already. So Health Scotland produced a child poverty briefing series. Hopefully you'll be aware of that as well. I've obviously led on developing the outcomes planning tool, and we're keen to continue to develop that. I've already been in contact with a couple of local areas with offers of coming out and facilitating outcomes planning sessions. But through that as well, outcomes planning is about a whole approach to planning. So it's not just about deciding what you do, but also embedding data and intelligence, both to inform planning and to continue to measure impact and improve things. So that's kind of what that package of support would look like. And what we'd probably like to do with that package of support is, and just be aware if you have approached me for outcomes planning support, is that we'd really want to then develop probably case studies of how we've worked more intensely with some areas and what we've learned from that to share across Scotland. Equally, we're interested in maybe working alongside some of our colleagues in the LIST team who are a local analytical support that NHS National Services Scotland fund, to try and do some maybe intensive work with one or two areas on their needs assessment to really understand what data is available, what are the key questions you want to be asking within that, and again, that would be shared as a kind of case study of practice for other areas to learn from. And obviously we've produced the case studies of current practice, and that is something that, as a group of national partners, we're keen to continue to develop as well. So just, if you're interested in the work of NHS Health Scotland, I have to promote our Children, Young People and Families Twitter account. We've been growing a section of our website on child poverty. It's got some useful, that should be Scott, sorry, I just realised typo. Useful child poverty resources on there, including a lot of work that my colleagues have been doing around income maximisation, referral pathways, and then that's my direct email address. And please, if we don't manage to catch me about anything today or something pops into your head later, please contact me directly as well with any comments.